Welcome viewers, welcome back to the yet another episode where we are continuing with the series we started, head to toe assessment of the newborn. And today we want to assess the eyes. So from inspection, just look at the color inside the eye, because there are abnormal colors you can pick, like if the baby is cyanosed or if there's a yellowish color, but that depends on the time you are doing this assessment. If there's yellowing, that it means it's jaundice, most likely pathological jaundice that normally occurs in 24 hours. All right, and then of course we will assess for any discharge in the eyes. So is there anything coming out of the eye? All right, that will help you to know whether or not maybe the baby might have picked an infection while in utero or not. So check for any discharge that could help us to diagnose maybe an infection. And then check for the symmetry between the two eyes. So they should be aligned. Okay, they should be well aligned. When you look at the eyes, they should be well aligned. And in between the two eyes, at least we are saying the distance should be at least approximately 3 centimeters. So the distance between the one eye to the other one should, and for sure this is 3 centimeters. We are also keen to check the color, okay, in the pupil. So in the pupil, all right, the pupil is normally that dark area you're seeing inside the eye. So for the pupil, we want to check if it's white in color. So if we are seeing any white coloration, that could be a complication that is normally called leukocoria. That could be a condition that will need us to refer this baby. And then of course, how is the pupil reacting to light? So it's good for us to use an ophthalmoscope or a pen light. We expect there to be a reaction. Otherwise, if there's no reaction, then it would mean something is wrong. Maybe there's an inflammation, all right, making the eye not to, the pupil not to actually react and to function very well. Still inside the eye, we can pick other abnormalities. For example, squint eyes. Okay, eyes that they look like they are crossed. Okay, so eyes that look like they are crossed. So this one will require us to refer this baby. And then of course check for any other injuries. Maybe there could be birth injuries. Picture an example where we have a face presentation, and especially when we are carrying out an examination, the vaginal examination, we can easily injure the eye. We can actually have bruises, or at the end of the day the baby is born and it is swollen due to the pressure of the birthing process. And with that we will be able to know how to take care of this baby better. As we are completing the assessment of the eye, remember all babies must be given tetracycline eye ointment on their eyes just to prevent any infections. There are also other conditions, for example, congenital blindness. Maybe the mother was being treated on TB. She was on anti-TB drugs, and one of the combination was streptomycin. So during the history taking, if you pick that up, then you can be anticipating problems like congenital blindness. And of course, we'll be able to look at some reflexes in the eyes, and we have one reflex called the blinking reflex. And this is simply when you pass any light across the baby's eyes, it will actually close the eyes and open. Then we also have the red reflex. This is a reflex where we are assessing to visualize the retina. So using the light, okay, you'll be able to pass the light, and if there's no reflection, right, then it means there could be a problem with the lens. So it just helps us to detect if there's congenital cataract as well that has the baby is having. So at the end of the day, for the eyes, we can pick so much that can help us to manage this baby even better. Thank you.